Diagnosed with a 10-degree scoliosis, what should you do? So understanding the treatment of scoliosis, the first thing we want to look at is how is scoliosis diagnosed? And scoliosis is the presence of an unnatural sideways curvature of the spine, and it's normally detected on a spinal X-ray. The spine normally has a curvature of 10 degrees or greater, and this curvature is also associated with a rotational component which twists from front to back. There's actually a turn that's occurring. And again, in order for it to be a scoliosis, it needs to be a minimum of 10 degrees on a Cobb angle measurement. A Cobb angle measurement is the gold standard for assessing scoliosis on a spinal X-ray. And the measurement is taken normally in a standing film, is the best way to do it. And the lines are drawn from the most tilted vertebra on the top part of the curvature versus the most tilted vertebra below the apex of the curvature. And this intersecting lines will give you an actual degrees, meaning 0 degrees being normal, and the higher the number, the more severe the scoliosis. There are different severity levels of scoliosis, and normally it's related to the patient's Cobb angle. The severity level is not determined by how the scoliosis is actually affecting the patient. A patient with a mild scoliosis is typically a Cobb angle measured between 10 and 25 degrees in this mild category. And in this mild category, more often than not, no treatment is recommended. Moderate scoliosis is between 25 and 40 degrees, and this is where a patient is considered to have a moderate curve. And in this case, more often than not, a patient is recommended no treatment again. Severe scoliosis is when a patient has a 40 degrees or plus or greater, and 40 degrees plus is when they call it severe scoliosis, and this is when they start considering spinal surgery as being the treatment option, when they go in with spinal fusion and rods of the spine and try to fuse the spine together. And then, of course, I have a fourth category, which I call very severe scoliosis, and this is 80 degrees plus, because at this number, I believe the scoliosis has a different type of treatment options that are associated with this type of category. Now, if a patient is actually diagnosed with a mild curvature, let's say at 10 degrees, like what should a person do if that diagnosis is at 10? Well, it's important to understand that scoliosis is a progressive problem, that every severe curve was once mild and once small. So normally curves don't go from 0 to 50 over one night. That's not what ends to happen. And normally it starts off very small and it progresses either over time as an adult or during growth as an adolescent. But either way, it's progressing over time. And therefore, small curves can become severe curves. So if you treat small curves, you're less likely to have a severe scoliosis. But scoliosis at the time of diagnosis, meaning if it's small, they'll say, well, it means, okay, we found it, but early detection is only important if you're going to treat something. Early detection isn't very important if you're just going to watch it and see what's going to happen, or maybe even do nothing. And this is the reason why a lot of scoliosis screenings have been abolished across the United States, because people were finding scoliosis early, like 10, 15, 20 degrees. But at this point, they said, oh, don't worry about it. Come back next year and let's see what's happened. And what's happened in that 12-month period of time, the curve progressed to severe standards, and now they said the patient needed surgery. So early detection actually did not reduce the amount of surgeries that were occurring in the United States, because they were still doing no treatment. They were still doing nothing and waiting for curves to become severe enough to qualify for surgical treatment, meaning 40 degrees or greater, and that's when they recommended surgery. So early detection is a very valuable when it comes to conservative treatment of scoliosis, because we know in conservative treatment of scoliosis, the smaller the curve, the better the results, because small curves are much easier to reduce surgically and can have a much greater percentage of reduction than a severe curve. So I recommend treating small curves, because treating a small curve can get a better approach or a better reduction. So how is a 10-degree scoliosis treated? Well, first of all, when we look at 10 degrees, we have to understand, number one, is the patient's history, meaning is there a history of scoliosis? Does somebody else in the family have a severe scoliosis? Is there other kids or other members that could maybe developed, or they've had previous surgery or previous treatment? So if there's only an isolated one person with a 10-degree scoliosis, the treatment might much less maybe much more conservative, meaning we may just do therapy or exercises or something along those lines. Where if somebody has has a history of scoliosis, meaning there's other siblings or some parents that have severe scoliosis, and we're seeing somebody with a 10 degrees curvature, we may be more likely to treat it because we're concerned about the progression that could occur. The age of the patient is also very important, because if the person is pre-puberty, meaning pre-growth, and they have a 10-degree curve, they're more likely to progress during growth, especially if they have other family members that have scoliosis as well, or if the person is post-puberty. If they're post-puberty with a 10-degree curve, well, maybe there'll be no treatment, just monitoring at that point because of the size of curvature. Also, the symptoms. If the patient has a 10-degree curvature and they're feeling no discomfort and they're post-puberty, well, maybe we'll just watch and see what's happening. Where if a person has a 10-degree curve and they're post-puberty and they're having pain, well, then we're going to want to treat the scoliosis, because we want to make sure not only are they feeling better, because the scoliosis is actually causing problems. So again, it's not just one treatment fits all here. We have to look at the entire picture. But most of the cases, when we look at traditional treatment options for curves that are around 10 degrees, there is no treatment recommended. Nothing. There is no strategy for treating for a mild scoliosis. And normally they're just said, watch and wait. And if it worsens, we'll do something regarding the curve. And normally worsens meaning becoming severe. And that's when they start considering surgery. And this is even true if a patient's experiencing pain. If a patient's experiencing pain as an adult and they have a mild scoliosis, they won't treat the scoliosis. They'll treat the pain with pain medications and injections, but they will not treat the scoliosis. And then very often, the scoliosis is actually discounted. They say, oh, you have a 15-degree curve, or you have a 10-degree curve, don't worry about it. They'll say they'll even tell the patient not to even worry about it, because it's not big enough to put a rod in their spine. Now, modern conservative non-surgical treatment is much more proactive. So here at Scoliosis Reduction Center, we use very proactive treatments in small curvatures, because small curves are much easier to reduce. And we can treat them conservatively, because we're not doing any type of, our treatment has no severe risks associated with it. So therefore, we can treat these curves and make smaller curves smaller, because I don't think anybody would argue that a straighter spine is always better than a more curved spine. So a 5-degree curve is better than a 10-degree curve. A 10-degree curve is better than a 15, and a 15 is better than a 20. So if you can make a curve smaller without being very invasive to the body, it's definitely something worth doing. So how do we deal with mild scoliosis without letting it get worse, or without using surgery to try to correct it or reduce it? Well, we know scoliosis isn't curable. There's no way of curing scoliosis. Even mild cases that we've reduced to 0, where we can say, okay, the scoliosis is completely cured, I believe whatever caused the scoliosis is still there. And it may continue, it may return if we're not monitoring it and being proactive in terms of what's going on, because we don't know in the majority of cases what causes the scoliosis, but we know scoliosis is highly treatable. And it's more treatable when the curve is smaller. So in a mild curve, the spine is still very flexible. The body hasn't had time to really sit and adjust to this unnatural curvature. During growth, we haven't had a big effect on growth or deformity of the bones and the ribs and the shoulders and the clavicles. And therefore, it's much easier to reduce these small curves. And it's much easier to get a much greater percentage of reduction. I mean, we can get 50, 60, 70% reduction in small curves, where in severe curves, we're looking at 25, 30, 35% reduction. So we much rather deal with a small curve. Conservative treatment options use a specific type of chiropractic care to help reduce these curves structurally. We use in-office therapies to help increase core strength, optimize spinal support, and the in-office therapy, we can also help pull and push the spine into a straighter position. We can even use corrective bracing to help augment all the therapy and all the chiropractic care that we're doing in the clinic. And the corrective bracing can be used to help straighten the spine, but it also can be used to help correct posture, meaning any asymmetry of the waist or shoulders that can even occur in small curves. And we also use home therapy and home exercise treatment as a customized prescribed home program to help support everything we're doing. And the goal of all of these treatments in this conservative approach is to reduce the size of curve, to make the curve smaller. Because the smaller the curve the patient has, whether an adult or a child, the less risk they have of worsening over time. So we know if we treat small curves, not only can we reduce a greater percentage of the curve, we can also reduce the risk of progression during growth, especially for adolescents, and we can reduce the risk of progression in the adult stage leading to pain and compression. So in both sides, we know smaller the curve, better. So all mild cases are different, meaning that how we treat it would be different, but the best time to treat scoliosis is always as soon as possible, because the smaller the curve, the better the reduction. The younger the patient, the better the reduction. And we know patients don't get younger as time goes, they only get older, and we know most curves only progress as time goes. They don't normally get smaller by themselves. So the benefits of early detection are only good if you're going to do something about what you find. If you're just going to watch and wait and let the curve continue to progress and then do surgery as the curve worsens, then why do early detection to begin with? So here at Scoliosis Reduction Center, we recommend early detection, we recommend spinal screenings, and we recommend early treatment as well, because that's going to have the biggest impact on a patient's future. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.